Hey, it's Tanya, and now we're going to talk about some nutrition. So, as a medical assistant, you have to think of yourself as a role model for your patients. Throughout your career, you're going to have a lot of opportunities to teach patients the essentials of good health and disease prevention. And by knowing how these behaviors through diet and exercise affect the short-term and long-term health is going to be very important for you. Okay, so this is when it comes to nutrition, education is really going to be key. So the first thing that we're going to look at is digestion. So digestion consists of both the physical and chemical breakdown of food into simpler substances that the body can use for energy. So digestion starts in the mouth, right, with the enzyme saliva starts to break it down. It's going to break down more into your stomach. Then you have your small intestines, where you start to have the absorption of nutrients into the bloodstream. Nutrients then are taken to the liver. They can be further broken down and filtered to every cell in the body. Okay. Any nutrients that aren't needed are eliminated from the body, or they can be stored as fat. So we have our digestion, and then we have metabolism. So metabolism, here you can see, is a sum of chemical processes that result in growth, energy production, elimination of waste, and body functions performed as digested nutrients are distributed, and the conversion of oxygen and calories to energy. The other mechanisms, we have our catabolism. Catabolism is the destruction phase. So that's where we break down these larger molecules into smaller ones. And anabolism, which is the constructive phase of metabolism. That's where we take smaller molecules and convert them into larger ones. So catabolism creates energy for us. This is typically measured in calories, and it's needed for cell growth and heat production. Okay. Anabolism, so nutrients reassembling to produce substances required by the body, that's anabolism. So that's when we're bringing things together. Now, the speed of these metabolic processes is going to be particular to each person, which is why some people, you can watch them, they can eat whatever they want and they maintain a healthy weight, where others consume the same amount of food and they gain weight. So it's going to vary from person to person. So now let's look at some essentials of nutrition. So making healthy food choices is the best way to try to maintain a state of wellness, okay, including homeostasis. And homeostasis is meaning maintaining a constant internal environment by balancing positive and negative feedback. So diet is very important. A diet that includes all the nutrients in adequate amounts is going to help your body maintain this homeostasis. We'll look at these nutrients. Essential nutrients that we're going to need that are found in food: vitamins and minerals, carbohydrates, proteins, fiber, fats, micronutrients, and water. We're going to look at these a little more closely. So we have carbohydrates. Those are chemical substances. They can be broken down by the body into simple sugars, which we call glucose. Okay, that helps provide energy to all the cells. Right? You find carbohydrates in grains, whole grains, fruits, vegetables, legumes, sugar. Right? So there's complex carbohydrates, these ones that are sustained and last a lot longer. Simple carbohydrates, very short acting. And then, of course, you have refined sugars, which are high calories, and they have no nutritious value at all. Next, we're going to look at proteins. Proteins contain amino acids. They help provide energy. The biggest thing about proteins, they build and repair tissue. Okay? They also assist with antibody production. They are found in nature. The human body needs 20 and it produces 11. The other 9 are called essential amino acids. Some animals, the proteins provide all of our necessary protein that we need. So you have complete proteins and incomplete. So complete proteins are things that are coming from animal products, right? So you see milk, cheese, eggs, meat, right? Those are complete proteins. And then you have incomplete, which are coming from plants, beans, legumes, nuts, and seeds. So there's the two different types. A combination of both of these types of proteins, the complete and incomplete, will make sure that we are getting the proper amount of protein in our diet. Fats. They're also known as lipids. They can serve as a concentrated source of heat production and energy, and they provide essential fatty acids for us. So you can see they're composed of carbon, hydrogen, and oxygen. So they have important functions. They can cushion and protect our organs, help us sustain our temperature, and they help with proper cell functioning. You can kind of review this table, the different types of fats, which ones are a little bit healthier and which ones are not. So you're going to look at this top half. These are the fats or the oils that don't raise cholesterol levels and that are benefiting to the body. Where you look at the bottom fats, they potentially can raise your bad cholesterol levels and increase your risk for heart disease. Then you see there on the bottom where it talks about trans fats, anything that's hydrogenated is turning into a trans fat, which is really bad for you. Vitamins, okay. Vitamins are organic substances that enhance the breakdown of proteins, carbohydrates, and fats. They're also used in the formation of blood cells and hormones and a production of vital neurochemicals. You can see there a whole range of different types of vitamins and where we can find them. And we have two different types of vitamins. We have fat soluble, that's absorbed with foods that contain fat. And excess amounts of those will be stored in the body, in the liver, in the kidneys, and body fat. Now, if you've ever been in one of my classes, you're going to know for the easy way for me to remember, I know it says ADEK. I always remember it as DEEK. I just like to put things in a word. So if you remember DEEK, D-E-A-K, those are fat-soluble vitamins. And then you have your water-soluble, which is your vitamin C, different B complex, your thiamine, folic acid. They should be consumed daily. The best way to consume those is by actually eating foods enriched with those vitamins. But if you take in extra, so if you're eating all of that stuff, but you're also taking B complex, most likely you're just peeing it out. Its excess is excreted by the body daily. So just be careful when you are taking fat soluble, when you take additional fat soluble vitamins on top of what you're eating, the extra can be stored in your body and it can result in serious illness. So more is not always better. Then we're going to look at minerals. Minerals are inorganic substances. They're used in the formation of hard and soft body tissue, helps us with muscle contraction, nerve conduction, and blood clotting, right? So we use all different types of minerals for different reasoning. Later on, when we talk about cardiac, we're going to talk about potassium, sodium potassium, how that helps us generate electrical impulse in our heart. Again, the calcium is also part of this. But you can see we do have some minerals required in small amounts. We call those trace minerals, fluorine, zinc, copper, cobalt, chromium. So we only need small amounts of those minerals. And you have cholesterol. Cholesterol is produced by all animals. It's contained in animal products. It's definitely necessary for body functioning. It's recommended that the adult daily consumption is less than 300 milligrams of dietary cholesterol to avoid excess cholesterol in the bloodstream. So when you have excess cholesterol in the bloodstream, it can result in plaque being built up in the blood vessels. Eventually, this is going to cause a blockage or an occlusion of a blood vessel. And so when you have a clot develop, we call a clot a thrombus, and it is potential for that cholesterol in that plaque to break free. And once a clot has broken free and it travels, we call that an embolism. Then you have lipoproteins. So lipoproteins are substances composed of both lipids and proteins that transport cholesterol between the liver and arterial walls. Okay, found only in the body, not food, and amounts and types are indicators of risk of heart disease. And we're going to go over the two different types. So you have low density lipoproteins, LDL, which we call the bad cholesterol. All right. This takes the cholesterol from the liver to the walls of the large and medium-sized arteries. So when we were just talking about the buildup of plaque, LDL is responsible for this. It's going to adhere to the walls, and initially your body's going to see that as a foreign invader, and it's going to bring white blood cells. The white blood cells will attach to that and eventually die off, which then the plaque will keep building on top of it. It's a vicious cycle, and eventually, like I said, it will clot, and that will cause impaired circulation. And then we have high density lipoproteins. That's our good cholesterol. That actually takes cholesterol away from the arterial walls to the liver, helps us remove cholesterol from our body. It reduces our risk of heart disease. So you want high levels of HDL, okay, and you want low levels of LDL. Fiber. So fiber, we see this in our vegetables, raw and cooked fruits. Now, when we're talking fruits, if you want the best fiber content, it's eating the skin, the peel that's on the fruit, or whole grains. So those are all fibers. They help with elimination. There are some patients with chronic colitis or ileitis who may have a low fiber diet. So that's one thing that you might be teaching. You're going to also encourage to avoid fatty foods and eat a lot of whole grains. Fiber will actually help pull off fats from a body. And of course, high fiber helps with constipation and regular bowel movements. So there are different guidelines. We've had the food pyramid a long time ago, and then we had the My Pyramid. You can see there with the vertical. And then in about 2011, the government came out with the myplate.gov. Now, it doesn't give you specific information about what serving sizes to eat, but it's just kind of recommending Americans to eat, say, in their day, at least half their plate should be fruits and vegetables, mostly vegetables, to drink maybe fat-free or 1% milk, to eat whole grains, try to decrease your sodium intake, and drink lots of water instead of sugary drinks. So that's really what the myplate.gov is trying to encourage Americans to eat. And then we'll look at some of the different food groups. So you have your grains, which, your bread, cereal, oatmeal, pasta, rice, okay? And then you have your vegetables, your fruits and vegetables. And really the thing with your fruits and vegetables, you should eat a rainbow. That's going to give you your best opportunity to try different or get different vitamins and minerals. Then you have your milk, all right, which we would consider the dairy. That's your yogurt and cheese group, so all milk and milk products. And then you have meat and beans, which we think of as our proteins, poultry, dry beans, nuts, seeds, eggs. And then our last group is oils. So fats that are solid at room temperature, like butter and shortening, or beef fat, chicken fat, they're not considered oils. We've changed the terminology from fats to oils because if things are solid at room temperature outside the body, they're pretty much going to be solid in your body. Okay, so we're trying to stay away from that. So if you're going with the oils, and we're going to look at healthier oils. So going back to that other list that was showing you the different fats, the types of oils that you should be consuming, the monounsaturated, the omega-3s, and the polyunsaturated, the list that was at the top of that one. All right, so food labels, understanding food labels. Now, a big part of your job is going to be explaining a food label to your patient and understanding what the different things are. So sodium is salt, and they need to kind of understand what is a recommended daily allowance, right? What somebody should have, and maybe the serving size in the particular container that they have, the amount of calories, carbohydrates, proteins. So you're going to help patients understand this and kind of figure out what they are ingesting in a day, right? And packages can be really tricky. A lot of times people will eat an entire can of soup, and maybe it's 2 or 3 servings, or a whole package of frozen meal, and again, it's 2 or 3 servings. So really trying to explain the different serving size and how things are broken down in each serving is going to help them understand what they're actually taking in. Therapeutic nutrition. So different lifespan age groups require different nutritional needs. All right, so a therapeutic diet in itself, it's a meal plan that controls the intake of certain foods or nutrients. It's usually part of a treatment for a medical condition, and it's normally prescribed by a physician. So therapeutic diet is a modification of what somebody regularly eats, and the medical assistant is going to be very vital into teaching patients about new diets. Diets are really the hardest part of lifestyle changes to make. And therapeutic diets can be modified for whether it's the nutrients that they need, maybe texture. If somebody has a swallowing difficulty, we might have to change it. If somebody has food allergies, food intolerance that they can't handle, maybe lactose intolerance or whatever. But regardless of the reason for the therapeutic diet, the purposes include facilitate the healing process, promoting healthy weight, assisting with chewing and swallowing, or influencing the components found in the blood, such as cholesterol, blood glucose. So you have to remember that there's a reason for them to have this diet, and it's important that they follow it. So some different types of therapeutic nutrition. So you can see there, no concentrated sweets, no added salt, low cholesterol, high fiber, pureed. Those are all different types there. One of the hardest diets for anybody to follow is the no added salt or reduced intake, a low sodium diet. Some other examples of diets you can see here on the right, the diabetes diet, DASH, which we use for hypertension, renal diet for chronic disease, and the dysphagia is for difficulty swallowing. Whenever you're working with therapeutic nutrition in the different diets in a provider's office, they're going to give you information to give to the patients and resources for them to be able to review. You will become familiar the more that you work with these different diets. Another nutrient is water. Okay, water is really important. It's about 60% of an adult's weight. So when we drink, whenever we're thirsty, that's a signal for us that our body's running low on water, and that's an important sign. Okay, but that will change as we age. But water is needed. It helps restore fluids that we might lose through metabolism, breathing. You actually breathe out moisture, sweating, and of course, when you eliminate, it helps to keep us cool, helps prevent us from overheating. It lubricates our joints and tissues. If you're taking in proper water, you have healthier skin. and you're going to have better digestion. We can't live without water. So you can survive up to, I think it's 6 weeks without food, but you can't last a week without water. Right? So how much should we be drinking? Now it'll vary. Some will say between 9 to 13 cups of water for men and women, right? Which turns out to be about 2,500 to 3,000 milliliters per day. But that's really going to vary depending on your physical activity, if you live in a warm climate, and maybe your body size. So it's just kind of a general guide for you to follow. If somebody has a fever, or if you're exercising, you're exposed to extreme temperature, um, you have excess loss of body fluids, maybe through vomiting or diarrhea, that's going to increase your fluid needs. The amount and color of your urine really is going to help determine if you need more or not. The darker the urine, the more concentrated it is, that means you need more water, okay? Alcohol actually dehydrates the body. So we have this antidiuretic hormone. It's a fluid regulating hormone that tells our kidneys to reduce urination so we can reabsorb water. Well, alcohol suppresses that. So it says, yeah, just go ahead and pee, so you get it out. All right. So we're flushing out all this water. When you drink alcohol and you're peeing more, it's because it's stopping that effect. So it's dehydrating you. And then caffeine. So a lot of people think that caffeine has a diuretic effect, meaning it's pulling fluids, but it really doesn't. So studies have shown that you can take in about 2 cups of coffee a day, and it might increase your urination in a little bit, but it's not going to lead to dehydration. Typically what they believe is caffeine will cause your bladder to spasm, and it's just making you pee. So caffeinated beverages, believe it or not, like coffee and tea, can actually contribute to your daily water intake. So when I went too far, when it's in moderation. All right, well, I jumped ahead here. So our other guide is giving you a breakdown of age groups about how much water they should be taking in your ounces. So you remember, if you want to ever convert it to milliliters, there's 30 milliliters per ounce. So you can kind of do that math there. But this is your guide for water based on the age. And if you're not taking in enough, we could have dehydration. So we were talking about thirst being an indicator earlier, and typically when you're thirsty, that's a sign that your body needs fluid, so you're going to replenish that. Unfortunately, as we age, our body's regulation of that fluid intake and thirst decline. So it's been shown that both of these factors are actually impaired in our elderly population. So there's other things like conditions that could also impair their mental ability and cognition, such as a stroke or dementia, that can hinder thirst, right? And there's times that people also might just limit drinking due to incontinence. They don't, that's where you pee a little bit, you have no control and you're urinating, or if they have difficulty getting to a bathroom, so they are limiting the amount that they drink. It's also been shown that athletes, people who are ill, and infants might not have an adequate sense of thirst to replace their fluid needs. So they might experience even mild hydration. So you have to be very careful. So that's where we try to encourage having, a couple, fill a 20-ounce water bottle a few times a day and be sipping throughout the day. That is important because otherwise symptoms of dehydration with just as little as a 2% water deficit, fatigue, confusion, mood changes, and it will increase, you can see, your risk for other medical conditions, urinary tract infections, kidney stones, gallstones, constipation. So water is very important. So again, we want to try to encourage people to be drinking throughout the day, or at least drink a large glass of water with each meal and snack, trying to get in that 2,500 to 3,000 milliliters during the day. All right, I think that covers it here for nutrition, and we'll move on.